Hello, thanks for joining us for today's edition of Spotlight Carolina. I'm Tiffany Irvin. My guest today is Dr. David Harley from Biltmore Plastic Surgery. Thanks so much for being here today.
Thank you for having me.
Absolutely. Now you have this wonderful product called the Biltmore Lift. Let's tell everyone what that is.
Well, the Biltmore lift is a minimally invasive face and neck lift which is performed under local anesthesia in the office setting.
Oh, so as opposed to being an inpatient in a hospital setting.
Exactly right, exactly right. The patients leave the office and they go directly to their home or to a hotel if they're coming from out of town.
What a great concept, and of course it's taken off. It's become very popular. Who are the potential patients that might be interested in this?
Well, we have a wide variety of patients. Patients have ranged in ages from 30s and 40s all the way up to their 80s. The most common ages are 50s and 60s. We work on both men and women. Really, the common denominator, the common complaint among these patients is an aged face, some sagging along the jawline, which is known as jowling, and particularly sagging in the neck, which is one of the most common complaints we hear about.
Yeah, so if they're having these complaints and they're able to come to you and have those taken care of, what's the typical patient experience like?
Well, the patients will come into my office and I will administer to these patients oral medications to relax them. So the medications are intended to give the patients a comfortable experience, and then once the patient's nice and relaxed, we take them back and numb the cheeks and numb the neck completely, just like the dentist uses the numbing medicine for the teeth, and then perform the procedure. Typically the procedure takes a couple of hours. At the end of the surgery, we will wake the patient up from sleep, because most patients sleep the entire procedure, and then we will walk them out. And at that time, a friend or family member will drive the patient home, and of course I will call them later that evening to check on them, and everyone has my cell phone number too, so they can get in touch with me. And then we always bring you back the next day for a follow-up visit.
And the recovery time, much quicker than a standard facelift?
The recovery time is approximately 7 to 10 days, and of course this varies. I've had patients that have returned to work 3 or 4 days after surgery, and I've also had those that have taken 2 weeks off. So it varies a little bit, but the average time is about 7 to 10 days before you're back out to social activities, out to lunch, the grocery store, or out to work.
All right, more information is available on this at biltmorelift.com. Thank you for joining us for another edition of Spotlight Carolina.